Welcome back to the Agenda Gap Facilitators Field Guide. Great to have you with us again.
Yeah, good to be here.
Okay, so we're jumping into Workshop 3 out of 14 today. We've already set the stage with the community agreement and that chat about everyday life affecting mental health.
Exactly. And this deep dive, it's all about Workshop 3, Mental Health Promotion 101.
Right.
The mission really is to get you ready to help youth unpack the difference between mental health and mental illness.
Okay.
And importantly, to see mental health as this vital resource and introduce that powerful idea of upstream mental health promotion.
Okay, upstream. So thinking about this session, it's about 2 hours,
Yeah.
right? What are the key things we want the youth walking away with?
Yeah, good question. By the end, they should be able to clearly explain mental health versus mental illness,
Okay.
define good mental health, social, emotional, psychological well-being, understand there are different ways to tackle mental health issues, and crucially, describe that upstream approach. We want them to see promotion as like a strengths-based thing, science-driven, not just posters.
Got it. So less awareness campaign, more building blocks.
Precisely.
And for us facilitators, what's the pre-game prep look like? What do we need ready?
Keep it straightforward. First, have that community agreement handy, in a format you can easily share.
Makes sense.
Also, dig out those awe evaluations from the last workshop, the anonymous ones.
Ah, yes, the awe.
Yeah, summarize the results, pull out any anonymous compliments. Sharing those at the start, it really helps build trust, builds that continuity.
Okay, good tip. So let's talk flow. How do we actually run this? Any delivery advice? How do we start?
Right. Kick off with a welcome activity. We suggest using weather terms. Ask everyone how they're feeling, like sunny, cloudy, but stormy. It's a nice, gentle way to check the room's energy.
I like that. Low stakes.
Totally.
Yeah.
Then for Connect and Open, that's where you share those awe summaries and compliments. Like we said, reinforces that safe space, shows you're listening.
And then it's time to dive into the main content.
Yeah, exactly.
Yeah.
We look forward, outline the plan, mental health, mental illness, upstream thinking. Oh, and negotiate a break time with them, too. Always good.
Right. Co-create the schedule a bit.
Then, gauging knowledge. Super important. Just ask, what comes to mind when you hear mental health?
And listen for.
Listen for everything, but especially highlight those strengths-based ideas. If someone mentions friendships or safe parks or community support.
Oh, okay. Signal those positive frames.
Yes. And then play the Let's Promote Mental Health video to set the stage.
Okay, so what about the core activities? The ones that really distinguish mental health from illness and introduce promotion?
Activity 1 is What is mental health? About 20 minutes. This is where you clarify things using the slides. Talk about mental health as well-being, emotional, psychological, social, and how it fluctuates. Versus mental illness, which involves diagnosed conditions. Use the WHO definition, the 4 quadrants model. That one's great for showing you can have a mental illness and still have good mental health.
That's a key distinction.
It really is. And the pyramid of mental health intervention, visual, show promotion as that big base layer, different from prevention or treatment.
Right.
Then maybe a quick trivia game, give examples, ask them which tier they fit in, promotion, prevention, treatment.
Fun way to check understanding.
Yeah.
Any tips for this part?
Yeah, it can be quite information heavy, so consciously build in spots for discussion, ask questions.
Got it.
And, if personal stories about mental illness come up, just gently remind everyone about confidentiality and mutual respect. Keep it safe.
Crucial reminder.
Okay.
So after laying that foundation, we hit the upstream concept.
Exactly. Activity 2, mental health promotion. About 15 minutes. This is all about upstream.
Explain that a bit more, the river analogy.
Yeah, like instead of just rescuing people downstream, you go upstream to find out why they're falling in the river.
Okay, tackling root causes.
Root causes, equity, being proactive instead of reactive, show the introduction to upstream and advocating for upstream videos. Then get them thinking, what are their protective factors for their own mental health at an individual level and in their community?
That can be abstract, though.
It can be, yeah. That upstream idea can be tricky at first. So definitely invite questions. Maybe walk through another example if needed, like what are upstream factors for healthy eating or getting exercise? Helps them see the different levers.
Good practical tip. Okay, how do we wrap it all up? Bring it home and the awe survey.
Right. Connect and close. Last 10 minutes or so. Shift focus to positive reflection. Ask something like, what's one experience you had this week where you felt you made a difference?
Nice. Ending on a positive contribution note.
Yeah. Then hand out the awe survey, give them a few minutes. If someone doesn't finish, just ask them to do it before the next session.
And send a link later.
Absolutely. Send that link by email for anyone who missed it or didn't finish. Follow-up is key.
This feels like a really foundational workshop. Shifting the lens to mental health as a resource, introducing that proactive upstream view.
It really is. It lays such important groundwork, helps them see well-being in a much broader, more empowering way.
So for facilitators getting ready for this session, what's maybe one final thought to chew on as they prepare?
I'd say consider how that upstream lens, how it can apply to any challenge, not just mental health. Think about how looking for root causes and building protective factors instead of just reacting could change how we approach things in our communities, aiming for stronger, more equitable outcomes. It's about seeing that bigger picture, right? Finding where the real leverage is.